Hi, and welcome back to Community Voices. I'm AnnaMarie Jones. I'm here to talk with Jennifer O'Meara and Greg Vitali, our state representatives representing parts of Delaware County and Montgomery County, and we're talking about the COVID update. Last time I spoke with you guys, it was about a month ago, I want to say. Is that right?
Yes.
And there's a lot that's happened. COVID-19 is bringing us through unprecedented, very fluid times, and we're all just rolling with the punches. And I think you're here to give us some really good news, though. What is that? Jennifer, do you want to start?
Yes, we found out Friday today that the Delaware County and the entire state of Pennsylvania were going to be in the yellow phase by June 5th, which is really good news because it allows a lot of businesses who are out of business to resume, and it gets us back to a little bit of the normal life that we were used to. There are still going to be restrictions in place, and we're still going to have to practice social distancing and wear masks and take other precautions, but it's a really good step in the right direction, and it means things are trending in the right direction. So I was very, very relieved to see that news.
Great. And Greg, what do you anticipate will happen in the yellow phase? Can you be more specific as to how businesses might open and give us an example of some?
Yeah, I mean, again, by no means an expert, but as I understand the yellow phase, it will mean that most businesses in some fashion can be open. There are certain businesses, that order encourages businesses that have been telecommuting, working from home, to continue to do that. There are certain categories of businesses that will not be open in the yellow phase. Don't expect your gym to be open. Don't expect to be able to go to a movie theater or casino. Don't expect to be able to go to an interior mall shop, because as I understand it, you need a store needs a door to the exterior to be opened under the yellow phase. So there will continue to be restrictions in retail businesses as it should, but it will offer a lot of relief. It's my understanding that indoor, bars and restaurants will not be opened interior during the yellow phase. So it's certainly not back to normal, but it's a step in the right direction. The stay-at-home order has been lifted. The number of people who can gather publicly has been increased. So it is a very significant and definite loosening, which will be welcomed by many, because as Jen knows, we've been getting there's been a lot of give and take, push and pull in Harrisburg from both sides of the aisle. Governor Wolf pushing in one direction and conservatives pushing in the opposite direction.
Right, I get it. And I do see on social media a lot of people saying hashtag mental health matters, and not very happy with the governor's decision to wait this long to open up and get to the yellow and then green phase a little bit after this. So what do you say to those who have felt frustrated at this point? And what can we give in terms of hope for seeing certain establishments open past the ones you've already mentioned, for instance, churches or maybe swimming pools this summer? Any information on that? And you can even use your own opinion if you'd like to throw that into the mix.
Well, it's my hope that the entire state is going to be in green before the summer is over. And so I've been trying to tell swim clubs not to make decisions for the entire summer, but to make them, 2 weeks or even a month at a time, to give people the hope that it will open eventually. And the swim clubs, I will say specifically in Delaware County, I've been talking to a swim club owner, a board member of one of my local swim clubs, and also been participating in at-large discussions with, because there's a whole lot of swim club families in this in Delaware County, and they have really reasonable plans in place for when we are in green that will allow them to open. I've also been trying to coordinate that with the Department of Health and encouraging them to look at swim clubs differently than, say, a gym, for example, because it's an outside entity rather than indoors. Um, and I've also just been reminding people that they're not in, we say we're in this together, and it sounds like cliche at this point, but it really isn't, right? We're all suffering. This is everyone's mental health is being impacted. This is a global pandemic that no one has ever seen before. And so it's frustrating, and being angry is a normal part of this. And so I understand when people are angry. I let them vent, and then I talk to them about the fact that Delaware County is still a hot spot, that we are trending in the right direction, but we have to be careful about the way we reopen. And I always bring it back to schools and childcare. If there's nowhere for kids to go, how are working parents supposed to go back to work? And that has been really an argument that everyone understands, because that's a problem we're all facing. And so we have to reopen strategically, and childcare has to reopen, and childcare does reopen in the yellow phase. And so that is really going to allow working people the opportunity to go back to work. And because we're also hearing from people who are having to go back to work now in the red phase, and they don't have anywhere to take their kids, and that's a legitimate problem. And so that's sort of been how I've been approaching this issue.
Right. And obviously it's a very nuanced situation. So many things have to be looked at in order to do this safely. So with that in mind, Greg, can you talk to me about mitigation of this versus containment? So how are we going to move safely in a nuanced fashion from mitigation to containment? Do you think that we will have testing enough to do that? And if we have testing enough to do that, where do we start? Who gets those tests first?
Yeah. I mean, back to your previous question, I think the first thing you have to underscore with people, this is a unprecedented, once in a lifetime situation. It's an extremely dangerous situation. And the governor is acting in a logical fashion based on science. Him and Secretary Levine are doing a very good job. Their plan, dividing risk zones into the color-coded red, yellow, green. They're allowing certain activities in each phase. It's very logical. And the movement of from one phase to the other based on statistical data is very logical. And people, they have to understand. And there is this push and pull in Harrisburg. The governor and generally Democrats on one side have been taking the cautious approach. And there's been this backlash, this pushback on the part of conservatives. And we've seen bill after bill trying to just open up occupation after occupation. They just try to do a veto override on things like dog grooming and cosmetology. And I think what I say to people who say these are my rights, I say, the reckless conduct of some is resulting in deaths of others. So we're in a situation where emergency powers are being enacted, and that's necessary to save the lives of senior citizens who are just being decimated in nursing homes and in other places. So it's important to stress to people in a nice way, yes, you might want a haircut, but getting your haircut or you getting your dog groomed may inadvertently result in someone's mother or grandmother dying of COVID. So I think you have to sort of bring people down to earth as to the situation we're in. And legislators who say, well, the governor's a tyrant and this and that, three branches of government co-equal. This is an emergency situation. The Constitution provides for emergency powers. The governor is exercising them. The whole point of emergency powers is to let one single person act because velocity is important in emergency situations. And that's what we're in, and it's temporary. So it is a give and take, and you have to say it to people in a nice way so it doesn't become a battle of wills and who wins the argument. But that's the point we're trying to to make the people. But I think, the fact that this is moving over time, that everyone's moving to yellow now, I think will take a little pressure off the situation. But the danger is still there. Just because you can go to some sort of social gathering doesn't mean you should. And anyway, I don't think I answered your question, but
yes, that brings me back to the containment issue. So if we're going to move from a point of social distancing to getting together more, and then maybe having the psychological thought of, well, I guess because we can move about more means we're safer, that it doesn't necessarily mean that. So what do we do about containment, especially for the elderly or those who are, at risk?
Well, I think that's where increased testing comes into play.
Right.
I know at nursing homes, they are now testing all residents and all staff. And their goal is to do that on a weekly basis, since you could test positive one day and or negative one day and positive a day later. So they have to increase that. There's also more testing availability now. The residents have the ability to call CVS or Rite Aid, and there's a testing site in Springfield, right around the corner from me, at a local CVS. Delaware County is also now offering sites. There was one set up this week that we're in at Upper Darby High School. And there's testing in Radnor. So that's really critical. They also, I know Pennsylvania's health department is working on setting up contract tracing teams of volunteers and workers they can employ. So when there is a hot spot, because that is going to occur when we reopen, they will be able to address that through contact tracing. And so that's going to be important. And then there's other things. That's where it comes into play that we still have to do our part. Wearing masks doesn't, that cuts down on people spreading it who are asymptomatic and may not know it. So as much as you might not want to wear a mask, it's still going to be important to wear one when you go out in public. And social distancing is still going to be important. So large gatherings aren't going to be taking place when we're in yellow. And well, that'll change as we move into green, but we're going to move as the case mitigation, as it allows us to.
Okay, very good. Anything you'd like to add to that, Greg?
no, I'm very concerned though, because, as I even move through my district, I, bike down County Line Road, pass by various bars, Sam's and the Italian Club. And I just see, as time is going on, an increasing number of people gathered outside who are not wearing masks, who are very close to each other. And clearly they're engaging in risky conduct. So there is that concern. I think that, the role of what I'm trying to do as a legislator is almost being a conduit for information. We pay close attention to the daily and bulletins the governor and others send out, and we try to filter them and send them to constituents so they know that what is happening, the resources are available, and so forth. So I think a lot of what my office, and I know Jen's office does too, is just give a lot of good information to constituents.
Okay, great. And what is the update on the budget? So last time we spoke, we talked about how the budget was down because businesses weren't open. So that's a direct effect of businesses not being open. Where are we now? I know that we have had money come in from the federal government. How is that going to be applied to our situation?
One rumor I just heard, I was just on a conference call with a bunch of environmental people. They feel they've heard there's going to be a 5-month budget that's going to take us beyond the next election, and it's going to be flat funding, pretty much the same funding that's currently in place for the various line items. That's going to continue for that 5-month period, and then figure out this mess afterwards. I know we are getting a lot of federal money. There very well may be restrictions on whether it can go into the general fund to help us. A lot of this federal money has very specific uses for which it must be used, and it simply can't backfill lost revenues in the general fund. So, yeah, this is going to be a challenge. I can say that the budget process, a normal budget process, us ends at the end of July. It's sort of at the negotiation at the staff level around now and moves forward. I haven't been hearing too much about the specifics or the negotiations, but broadly speaking, I think that's what's happening.
Okay, Jennifer, anything to add? And if you want to also include information on people who might have received a stimulus check or may still be waiting for round one, and I know round two is happening soon. What updates can you give us on that?
Well, I think Greg hit the nail on the head with the budget update. Unfortunately, we don't know more. It's going to be tough though, and what my focus is going to be is protecting education and a couple other key things that I don't want to bear the brunt of these budget cuts. In terms of the stimulus check, unfortunately, that's really out of our wheelhouse. We're in Harrisburg. The stimulus checks have been coming from DC. However, my office, and I'm sure Greg's office, is still able to help connect you with Congresswoman Scanlon, who can look into it. I know there are still some people that are facing issues, so we're happy to help anyone who may still be waiting for their stimulus check. We've already done it a couple of times.
Thank you for providing that for constituents.
I think the checks that me and Jen are dealing with, and Jen, you can chime in and agree, are the unemployment checks. I think unemployment compensation checks. Jen, I'm sure your office is getting just a ton of calls on that because the system has been just swamped with requests, as you could imagine. And both of our offices are just very active in trying to just answer people's questions and guide them through the system.
All right. And what do you guys think in terms of mental health? What are some ways that people are coping with this? I mean, so many loved ones have died due to COVID or otherwise, and they haven't been able to mourn the way that they would want to by gathering with family. And churches aren't open right now. So like, what do you see happening? And you can give your own opinion in terms of operational, like how can people deal with this or gather together in a safe way to mourn or pray or be in community spiritually?
I think as we move forward, as things start to move from red to yellow to green, we're going to see people have more outside gatherings. I think we're going to see churches conduct services outside, spread out on lawns, because if you're outside and you're wearing masks and you're practicing social distancing, it's my opinion that people can safely and smartly conduct themselves. They'll have to be mindful of how large the gathering is, though, and just if someone is not feeling well, they should stay home and be really careful because we're seeing, there was just a story in California where one person went to church. They were COVID positive and they could have infected up to 183 people that day. So we have to be really careful and people really have to follow the guidelines as much as possible. And I know it's not the same, but try ways to connect virtually and be creative about it. My family sang happy birthday to my brother via Zoom. We were all together. I've done trivia nights with friends. I've actually found myself reconnecting with friends that live far away that I haven't seen in a while because we have time and we can schedule a Zoom date. So try to remember that we're socially distancing, but we're not socially isolated. And the technology that exists in today's world really allows us to still enjoy a lot of things. And let's just hope that we have a nice summer that doesn't leave us without power like it did last summer, which was a huge problem, because that will end up that's when this is going to get really untenable. And I hope people remember that outside things like parks and trails, they are open. So this is a great way to enjoy a community treasure that you may not have previously enjoyed. And, I'm in Springfield and we have the Springfield Trail, but I know the Radnor Trail's up in Radnor as well. And I just hope people take advantage of those local resources.
Now, there's so many preservations we're discovering around here, and I found some through natlands.org that are part of our communities and maybe on the outskirts of the areas that you cover, Jen and Greg. But they're really amazing, beautiful, not very crowded natural lands that you could just walk with your family and find a stream. It's been a really nice reprieve for us.
Yeah, one thing that I've noticed that's been a nice, refreshing thing is there are children outside playing in my neighborhood, and I hear them at night from like 4 to 8 o'clock. And the other night at a gas station, I watched a dad teach his two daughters how to pump gas, and you're seeing a return to some family traditions that we've gotten astray from because we have time to pause and to be with our contained family unit. So I know it's very stressful for parents who have kids at home and who are dying to get them with their grandparents for a weekend. But there's also something to be said for the reflection that's allowed to occur during this time. And I hope people can find some way to enjoy that.
I couldn't agree more. And what about going back to mental health? Do you have any resources you can provide to people watching if they are feeling disconnected and not really able to focus on the things that we're talking about? If they're just in a place and they need some help and they need to reach out to someone, where can they go?
Well, the only thing I was going to suggest on the legislative side, I think, and I know Jen's office does this too. People reach out to us for help, and I think we have to. And a lot of times just to vent, and they have a lot of frustrations about not receiving their unemployment check or other things that just aren't going right. And it's very important to just deal with them with compassion. If they need to vent, if they need to, use us as a human punching bag for a little bit. Just absorb it within reason. And so that's one thing legislatively to help people through tough times. And the other is just as legislators, sort of being responsive. You certainly want to be safe, but you don't want to put people in absurd situations too and prevent them from doing certain activities like for no good reason that don't really have a health risk. So, trying to be responsive legislatively, trying to continue to communicate with the governor about certain activities like keeping parks open and making sure he is restrictive, but not more restrictive than possible. So I think that, just on the legislative side, being responsive legislatively and in the district office, just being sympathetic and empathetic to the problems people are going through are two things we can do.
Yeah.
Yeah, there are also, I agree with everything Greg said. I'd add that there are also some resources. People can text PA to 741-741. It's a crisis text line. There's also the National Suicide Prevention Lifeline, which is 1-800-273-8255. And there's also a bunch of different resources that I have in a little graphic right here that I can send to you that you can share with viewers that I've been also sharing and trying to make sure I put out there as much as possible because, I've been an advocate for mental health for a long time. And this is unfortunately highlighting the urgent need to address that and to put more resources there for people.
Thank you very much. And before we have to wrap up, I think it's really important to talk about, and Greg, if you can address this, the upcoming election. We have a primary. It's so important that people get out there and vote. Can you address the ballots situation and also the consolidation of places to vote?
Sure. Okay, so the primary election is June 2nd. There are primary contests on the Democratic side, state house race in the 166th, the state senatorial district in the 17th. So there are reasons to vote. If you've applied for an absentee ballot, return it as quickly as possible. It's the polling places will be different. Some will be the same, some will be different. We'll be getting those lists out to you. In Radnor, they'll be voting at the elementary school, the middle school, and the senior high and the middle school. They won't be voting at some of the smaller places. So check before you go. You should be getting a notice. So turn in those absentee ballots as quickly as possible. If you're going to go to the polls, be safe and make sure you're going to the right place.
I just got mine today. So excited.
Okay.
Yeah. And one thing I would add is definitely double check before you go to make sure you're going to the right polling place. You can find that at votespa.com. But remember that many of our poll workers are senior citizens, and they are often our most vulnerable residents. So please consider wearing a mask and practicing social distancing when you vote, and being mindful of the people that are allowing us the opportunity to get out and vote in person and by mail this year.
Absolutely. Well, guys, I can't thank you enough for this update today. I think we have a lot of great things to look forward to in this, very disconcerting time. And I really look forward to the times we get to talk and address the new situations that are occurring during COVID-19. So will you join me again next month? Can we keep this going?
Sounds like a plan.
All right, guys. Thank you so much for joining me. And everyone, thank you for tuning in to Community Voices. I look forward to seeing you next month for the next update. And everyone stay safe and happy Memorial Day. Bye.